at this time, we'll go ahead and get started, and I just want to make a point. You know, throughout the day, we have learned how vital healthcare is in basically every single thing we do in this state, and especially when it comes to economic development. And right now in Mississippi, there's a new development that is a very visible example of what a difference it will make when you put this type of effort into economic development. And that is the medical city that's being developed at Tradition on the Mississippi Gulf Coast. To tell us more about this, please welcome Donna Arduin with Arduin Laffer Moore Econometrics.
Thank you, Scott. Together with me, I have Dr. Peter Foss, the new Executive Director of Endori Institute at Tradition. We're here to present briefly our research results on the developments at Tradition and the economic development potential, as well as the healthcare economic potential at Tradition. We were commissioned by the Southern Mississippi Planning and Development District, along with the University of Southern Mississippi, to look at the economic issues and specifically diabetes and obesity issues in Mississippi, and how the development at Tradition can go a long way to marrying the two to bring about positive economic results. This is the planning vision. Hopefully you can take a look at some of the pictures up close, because it's quite tremendous what's happening and the vision for what will be happening at Tradition. Our job was to look at the potential for the economic upswing and growth, bringing together higher education and the potential for a full-blown life sciences cluster at Tradition, which would result in high-wage industries and address the issues of the problems in Mississippi derived from obesity and diabetes, in particular low productivity and low participation rate in the workforce. One of the things we took a look at, our firm, along with the American Legislative Exchange Conference every year, ranks states on their economic performance to date in the last 10 years and what we think our outlook is. And I stopped on this slide because we rarely see such a gulf, and I mean gulf, between your rank and your outlook. And in Mississippi, unfortunately, we've ranked you 44th, that's worst, but our outlook is significantly better. Well, why? As you've talked with your site selection folks, you know that there are a lot of things, including good climate down here, that contribute to a very positive economic climate. What we want to focus on here are those things that are the problems we need to overcome and how Tradition can add to those. So we talked about a lot today, lack of industry diversity. Well, none of these things in the bullet points happen by themselves. You're not going to get industry diversity without both investments in business and, in the case of Tradition, investments in your health care, as you've been talking about today. Specifically, we focused on diabetes and obesity research. There is a very strong correlation in all 50 states between diabetes and obesity and productivity rates among workers and poverty rates in the states. So if you can reverse the incidence of diabetes and obesity in your state, you're going to bring up your productivity and help you expand and diversify your economy. We also talked about the Gulf Coast region specifically, and as you know, the Gulf Coast region has had more than its share of problems in the last 10 years, including Katrina and the BP oil spill. So Mississippi has great potential, it just needs to be unlocked. Dr. Foss is going to talk specifically about the prevalence of diabetes and the cost, the economic cost of diabetes, before I get into the results of our economic development potential study for tradition.
Thank you very much. Good afternoon, everyone. Hope you're enjoying your meal. I'm here to tell you really some of the costs that diabetes affects Mississippi. You can click it. It costs about $3.5 billion a year because of obesity and diabetes together. And it's important to understand that 15.4% of the adults in Mississippi have diabetes. That's about 400,000 people. Another 800,000 have prediabetes. So you can see the impact. And for a person who has diabetes, their direct medical care costs are 2.3 times higher than anyone else. So the diabetes is really an economic engine in the wrong direction, and the cost, total counting opportunity costs, et cetera, is $3.5 billion. So it's not just a disease that we should take care of for people's wellness, but it actually has an economic impact that we need to correct.
So the developments at Tradition are crucial to improving Mississippi as well as the Gulf Coast economies. I want to tease up the results of our economic study. These numbers that I'm going to present are exclusive of the economic development potential from any reduction in diabetes. The potential for Tradition over 10 years, just looking at what is happening right now, the planned future development, and the addition of a College of Medicine, we have determined that over 10 years, we can increase the economic impact to the region by 1.3 to almost $2 billion. The developments at Tradition are numerous. If you can look at the slide briefly, the light blue circles show those investments that have already been made in Tradition, including the Endori National Diabetes and Obesity Research Institute presence that Dr. Young talked about this morning. The Memorial Clinic, the School of Pharmacy, and the Nursing School, which Dr. Foss will talk about in a moment. We also have underway commercial and residential development, and planned for the future, and critically important, are the 100,000 square foot facility for Endori, as well as a College of Medicine. These are examples of investments that Mississippi has made, and you're quite familiar with, that have been successful magnets in attracting industry that's diverse and higher paying. In the case of biomedical and medical city developments, I think you heard a lot this morning about some of the other ingredients that you need besides investment, our research institute in conjunction with the College of Medicine. These are some of the partners that Tradition is working with. Dr. Foss, I'd like to talk to you about what's happening at Tradition right now.
It's my pleasure to talk about this because I was involved years ago when this was being planned. But what's happening right now, the latest thing that happened was the opening of the Bryant Center School of Nursing and Simulation lab for Mississippi Gulf Coast Community College. The significance of this is that Mississippi Gulf Coast Community College had nursing programs at multiple campuses. Now all the nursing students and nursing faculty work under one roof. Right now there's about 800 students there, and it has the capacity to grow to about 1,000. And I think in one of the panels, the Dean of Nursing School at UMC told us about the nursing shortage. So here we have an area which can train more nursing students and have the collaboration of all the people who work there. Also, the School of Pharmacy at William Carey University actually opened about 2 weeks ago, and for a full class. And the significance of that is that they've adopted an accelerated curriculum where students can graduate after 3 years of pharmacy school. And I don't have the numbers, but the pharmacists shortage is just as significant. Also, Memorial Hospital in Gulfport actually has a clinic now on at Tradition, and which is treating people, and we actually have an endocrinologist. So by the way, there's only 39 endocrinologists in the state of Mississippi. That is the specialist that the primary care physicians will send to. It's only 39 in the state. There's 82 counties in the state. So you can see the shortage that we have right there. And one last thing, talk about the significance of both the pharmacy school and the nursing school will be literally walking distance away, is that it's the same thing that Dr. Young talked about in Cleveland, where they're putting everything on one roof. Well, there's a collaboration and the possibility of pharmacy students taking the same classes in nutrition and epidemiology with nursing students. So the team that needs to be done, that needs to be developed, can actually happen during their education. And forthcoming plan will be sort of the anchor store of the Learning Medical City, and that's the National Diabetes and Obesity Research Institute facility. It'll be on 100,000 square feet. It'll be large enough to have basic science, large enough to do clinical trials, large enough actually to treat patients, and it'll be walking distance from the other developments. So a nursing student, a pharmacy student can actually go into the Institute's facility and actually participate in clinical trials, which will make them a much better prepared health professional. College of Medicine, we talked about that a little bit earlier. William Carey has osteopathic medical school in Hattiesburg. There's a plan to have one in Tradition, so you might ask yourself, well, why would you need another one? There's one in Oxford, one in Hattiesburg, isn't that enough? Well, just to let you know that Mississippi ranks 50th, and 50 is the worst, in the density of physicians to people. We have less physicians per person than any other state in the union. And the shortage of physicians by 2020, based on AAMC, will be 121,000 more physicians are needed, not just the ones replacing retired physicians. So we need as many medical schools as we need. And this will also fit in again to the Learning Medical City that we built in that tradition. And one last development that we're working on is that Coastal Family Health, which is one of the 21 federally qualified health clinics in the state, which has 13 clinics across the Mississippi Gulf Coast, will eventually move to a facility at Tradition, and also have the administrative offices. They will be treating patients. They serve about 30,000 patients. They will be treating patients that, again, the medical school students can work with, the nursing school students can work with, and the pharmacy schools work with. Because what's happening now in pharmacy is that a pharmacist no longer just counts pills. They actually are part of the healthcare team. Yeah, thanks, Hugh.
We were also asked by Tradition to determine whether or not the development there has the potential to become a full-blown research cluster. My firm has been studying research clusters around the country for decades, and they all have several ingredients in common. We determined that, yes, Tradition does have the potential to become a full-blown research cluster. Some of those ingredients include infrastructure, located on major highway 67, access to airports, of course, desirable climate. Research scientists can decide where they want to live in this country. Low construction costs, low cost of living, it's very important. It's why they're no longer wanting to continue to move to the San Diego area. Other things include patient density, access to clinics and hospitals, and I heard a lot of discussion about that today as well. Here's a couple of examples of research clusters. Of course, the Research Triangle in North Carolina, and you might say, well, how can we ever, become like them? Well, Raleigh-Durham, Chapel Hill wasn't always what it is now. As a more recent example, the Orlando area. I worked with the Lake Nona developers and University of Central Florida 12 years ago on the instigation of Medical City in Lake Nona. And what you see in that picture right now, none of that existed at the time. So I told the folks at Tradition that they've got a jump start on Lake Nona. All of the similar clusters bring about extraordinary growth in GDP, wage growth, and of course, jobs. Don't need to tell you that where you are right now, especially in the Gulfport region, you're lagging the United States in growth, but like the Research Triangle clusters in North Carolina and Lake Nona, you can excel with the tradition developments, if you include the College of Medicine. So in sum, our economic development research found that even without a full-blown research cluster in the next 10 years, that with the developments that are going on in tradition, along with the College of Medicine, you can increase your number of jobs by up to 7,000 jobs, almost $1 billion in wages, over $1 billion in new GDP, and with a full research cluster, we're talking about $2 billion in additional GDP and over 9,000 jobs. Okay. That's a return on investment to the state in terms of GDP. If the state were to invest $77,000 of either BP, Horizon oil spill money or taxpayer dollars, of an over 200 to 400% return on GDP for every tax or oil spill dollar invested, and the state would recoup its costs in 8 to 11 years. None of those numbers, again, take into account what the potential for increasing economic development, not only in the region, but for the whole state, and any reduction in diabetes that results from the research at Tradition. I want to thank you. Thank you for your time today and for a wonderful conference. Thank you, Governor.
What that just shows us is we have a great deal of potential. We have the opportunity in front of us to really seize the day when it comes to healthcare, and we're very excited about learning more about what's going to be happening in the coming years. As you know, U.S. Housing and Urban Development Secretary Dr. Ben Carson was scheduled to be with us today, but a cabinet meeting called by President Trump kept him in Washington. However, he did want to make sure that he let you know that he was sorry he was unable to attend, and he has provided a special video message for you today.
Hi, I'm Housing Secretary Ben Carson, and I want to thank Governor Bryant for the invitation to come to your conference, but pressing needs have kept me away, so unfortunately I cannot attend. But I can thank all those who are attending, from healthcare providers to industry leaders to other stakeholders, for your dedication and commitment to helping make healthcare an economic driver in Mississippi. Mississippi has struggled in the past with a number of critical public health issues, but today you are clearly making good headway in helping solve these challenges. And we at HUD are working hard to keep the momentum going by addressing the health needs of vulnerable families in Mississippi who receive federal housing assistance. I'm very sensitive to this topic because as I was operating on and treating children as a pediatric neurosurgeon at Johns Hopkins, my goal was to help them overcome very serious health problems, to offer them a second chance at life, the possibility of a normal childhood, and more. I feel this way at HUD, that we should be in the vanguard of reducing lead exposure and other residential health hazards, along with opioid addiction and other personal illnesses, so the families we serve in Mississippi can also reach a state of wellness, which will allow them to achieve financial independence and thereby increase their contributions to their communities and neighborhoods. I want to remind everyone that we appreciate your work, we strongly support your efforts, and that HUD will continue to provide the resources and tools to help you successfully meet your worthy goals. I look forward to hearing from Governor Bryant on all your accomplishments in coming days. All the best.
As I've looked, as we started at 8 o'clock this morning, it's probably about 1:30. The information that we've been able to share, having not only Dr. Carson here from Washington, D.C., but the president head of the American Medical Association. These are things that once would have been seen as difficult, if not impossible, to achieve in Mississippi. But here we are. We've just achieved them. We've talked about the achievements that have occurred in the state of Mississippi. 7 years ago, we had no new medical school. 7 years ago, there was no medical city. 7 years ago, very few companies, corporations had clinics within inside the walls of their manufacturing facilities. So much has happened. Now we've got to turn our attention to making sure that we have the very best physicians here, that they don't have to leave the state of Mississippi. So we are creating an infrastructure, just as we would with roads and bridges, an infrastructure that will maintain the high quality of health care that the very best physicians and nurses and practitioners and health care providers can assure. Now, I can tell you we're making progress. I was just looking yesterday online, perhaps it was this morning, Physicians Practice. They said this: the Magnolia State, Mississippi, was identified as being the most physician-friendly for this year of 2017. The number one state in Mississippi, or number one state in America, to practice medicine is right here in the Magnolia State. So we're going to keep sharing that information. I'll give you a list because I love to do this. Number one, Mississippi. Number two, a place called Texas. Right behind Mississippi, right behind as Alaska, and number four, California, number five, Arkansas. So when you see friends from any of those states and they start asking you about Mississippi, say, well, we're going to come out there and see if we can't help you guys understand how it is to be physician-friendly in the golden state of California. I'm so proud to be able to say that we are making this progress because challenges lay ahead. We have a population that is often their own worst enemy. If I could stop the abuse of drugs and alcohol, if I could stop people from smoking, if I could get them to exercise a little bit and control their weight, can you imagine the savings not only at the treasury of the state of Mississippi, but the quality of life for those individuals? We've been able to reduce teen pregnancy by 26% in the state of Mississippi in the last 7 years. People said that couldn't be done either, but it has. So those prenatal challenges that occurred so often when a young girl was there and wouldn't tell anyone she was pregnant, we found out months into the pregnancy. Now we're able to understand that it is so much better for her and for the entire family and for that child if they will wait to their adult years to make those adult decisions. We talked about food deserts. I'm from Morehead, Mississippi. Back in Morehead and Sunflower County, we had these amazing things when I was a child. They were called gardens. And you could take seeds and plant them. Now, I haven't had a garden since I've been an adult. I made an agreement with the Lord one day. If he'd get me out of an okra patch, I'd never have one. But we're going to try to work with our Secretary of Agriculture and Commerce here, and we have before with Farm Bureau, seeing if we can't help create vital opportunities in the Mississippi Delta and Southwest Mississippi where you can have a piece of land that you might be able to go and farm and raise your own fruit. Well, I'm sure that we would give the necessary training and assistance that they would need. But there are solutions to these problems. The healthcare city, as we saw earlier at Traditions, is just absolutely remarkable. I travel around the nation, around the state, and tell people about it. They ask, where? When did that happen? Well, it happened organically. It began to grow with a lot of hard work, and we're going to need it. We're going to need all those osteopathic doctors. Just now, I'm part of an organization called Baby Boomers. There's some of us in the room, we said earlier, 74 million baby boomers exist today. 74 million born about 1947 to 1964. We are rushing towards health care like a tsunami. In about another decade, we'll hit it full force. If we don't have the infrastructure, if we don't have the physicians, if we don't have the systems that will be able to meet that, and accomplish it. America will face a healthcare crisis that we have not seen in centuries. So we're working hard in Mississippi to get ready for that. I want to thank every one of you here today. I want to thank MEC, Clay Hayes, all our sponsors, everyone in the room. What's unique about this particular event, everyone at every table within this room has had something to do with today's event. This is a participatory event, and y'all have all been great participants. So thank you. It has been about 5 years since we had one of these meetings, and we think that's about right, particularly since I've only had a year and a half to be governor. So 5 years from now, someone else will probably be up here, I hope they will, or sooner, telling you all the great accomplishments that have occurred in health care and in the individual health of Mississippians, because we are becoming a healthier state, and that is where we all hope to be. Thank y'all so much for being here. Have a great day, and God bless you all.
Our message is that the development at Tradition in the Gulf Coast of Mississippi has the potential to become a full-blown research cluster like that in North Carolina and the Orlando area of Florida, and particularly focused on diabetes and obesity research and solving both economic development problems and health economic development problems in Mississippi.
What will it take for Mississippi to get to the next level when it comes to healthcare?
When it comes to healthcare, investments in academics and healthcare in conjunction with research institutes, as well as a focus on increasing the productivity of the population, in particular on diabetes and obesity research.
Where does Mississippi rank compared to other southern states in its efforts to spur the economic development of its healthcare sector?
Well, this conference has been a terrific success. Mississippi has been very successful in spurring industries to diversify the economy, and a concentration on healthcare is precisely what they need to be doing for the future. Opening up not only higher wage industries, but a healthier population, which will increase your productivity and draw higher wage industries across the state.